I think exercise is the single most important longevity drug we have, bar none. Like if you said like, I want to go deep down the rabbit hole of living longer, what do I need to do? It's like a super well-crafted exercise program that is geared towards strength, muscle mass, and cardiorespiratory fitness.
So it's all of the above. It's not just one.
Right.
So
I mean, the hazard ratios for each of these are pretty interesting. This has become like, each year I try to bring one new focus into our practice, and the past 12 months, the focus has been entirely around taking exercise to a new level in terms of our understanding of how to fine-tune it. And the data are unbelievable, right? So everybody knows that if you smoke or have diabetes, your risk of death goes up a lot. But your risk of death from having high cardiorespiratory fitness goes down by much more than your risk of death goes up from smoking or diabetes. So smoking and diabetes will double or triple your risk of death, depending on the time frame you're looking at. Having very high cardiorespiratory fitness, so having a VO2 max that is elite, we would define that as the top 2.5% of the population, compared to below average, is a 5-fold reduction in all-cause mortality. Wow. Death from any kind.
Whoa.
I mean, we don't have drugs that have a 5x reduction in mortality.
That's incredible. And that's just elite cardiovascular health.
Right. And then when you layer in strength and muscle mass, we actually now have pretty good data as to the fact that strength is more important than muscle mass. We just use muscle mass as a good proxy for strength, but if you just focus on strength, that's the metric that matters. It's about a 3-fold reduction in all-cause mortality when you compare high strength to low strength. And the tests are, we're talking, it's not like how much you can squat and deadlift. It's like grip strength, dead hang, how long can you do like an air squat? Like what's your quad strength? How quickly can you do 5 reps up and down from a chair? I mean, it's relatively simple stuff. But when you stratify people by those metrics and you compare the highest to the lowest performers, there's just no comparison.